I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my loves, and welcome back to the Love and Science podcast. I am so excited for this episode today. I have a dear friend and a colleague. Her name is Dr. Esra Shermadou, and she is an amazing human. We're going to have such a beautiful conversation. So, by way of introduction, she's a board-certified family medicine physician and a diplomat of the American Board of Obesity Medicine. After navigating her own journey with premature ovarian insufficiency, she became deeply passionate about women's health, hormone therapy, and sustainable lifestyle change. Her lived experiences influence her patient care, especially her commitment to helping others take back control of their health, which is amazing. Obviously, taking back our agency is what we do at Love and Science. So she is the founder of Sakina Health, which is a new direct primary care clinic in Dayton, Ohio. And it is designed to support both women and men feel like themselves again. And so we'll get into that too. But Dr. Esra, I just want to welcome you. Thank you so much for being here today.
Yes, thank you so much for having me. I'm so excited to be here.
Yeah, absolutely. And I have actually never explicitly talked about primary ovarian insufficiency on the podcast before. We've talked about a lot of things. We've talked about diminished ovarian reserve, but can you share with us your journey of your, sort of getting the diagnosis, how you got there, all of those things?
Yes, absolutely. So, yes, premature ovarian insufficiency. So that's when you have loss of ovarian function before the age of 40, and it can be caused by multiple different things. So in my case, it was due to chemotherapy, but it can be autoimmune from different medications, so many different things. So I was diagnosed with cancer when I was 21. I was diagnosed with lymphoma. Honestly, just kind of woke up one morning, had a whole bunch of swelling in my neck, and we went from there. And so
Wow.
I went through a long journey with chemotherapy that ended with a stem cell transplant. And so because of all of the chemo that I had, there was a risk of losing ovarian function, which I did ultimately end up experiencing. And so it was, at the time of diagnosis, we did briefly talk about some options to try to protect my ovaries, but to be honest, I thought it was very, like looking back, it was a very quick conversation. And, I think part of that was just kind of where medicine was at the time. And so, but since then, it was just kind of like experience learning. I felt like a lot of learning on my own. I've had to support myself through this diagnosis, and it's been quite the journey.
Yeah, no, 100%. So if you don't mind my asking, how old are you now?
I am 36.
36. Okay. And how old were you when you were diagnosed? You were in college?
Yeah, so I was
Yeah.
21. So the 21 was when I started the journey. I went through a year of treatment. So about 22 is when I finished treatment. And then we just kind of were like, okay, like it might take a little bit of time for your ovaries to kind of wake back up.
Yeah.
I ultimately was on birth control pills during my cancer treatment to try to maybe somewhat preserve them a little bit. And so I came off of them after treatment, and it was probably maybe like 8 months later, I kind of brought it up to my oncologist, like, hey, like, should they be back? Should my cycles be back? Yeah, like, and so at that point, she sent me to an REI, reproductive endocrinologist, who did some testing and looking at my AMH and other levels, and everything was very low, very suppressed. And so we tried a couple different like supplements at the time, and to try to see if that would stimulate the ovaries again, but unfortunately did not. And so I was just kind of told, hey, you need to be on birth control pills until about the age of 51. And that was kind of it. And then right after that, I was or during that process, I was just starting med school. And so that was like 2.5 hours away. And so, you know how it is, like in med school and in training, there's no time to go to the doctor. So I was just like,
No.
so I'd be on birth control pills and then I'd run out of my prescription. And, you know, when I'd go back home, it'd be on the weekends. And so there wasn't enough time to go to the doctor then.
Mm,
And so I would be off my birth control pills for like months, years at a time. And, you know, because I didn't know the importance of
right.
hormones. I was just told, hey, you need to be on these. And then, you know, you go to med school and then you learn about the WHI study and how apparently bad hormones are. And I was like, well, I don't want to be on these. Like, what's the point of taking them now? And so
Right.
I would just like, you know, I wasn't motivated to take them. And for me, I didn't have any significant like hot flashes or anything like that. I think for me, looking back, I think sleep was a big thing for me. And then maybe a little bit of like mood, like anxiety
Mm,
type. But then, you know, maybe is that part of med school too? Like, you
right,
know,
right,
so
right.
lots of different things. But so yeah, that was, I didn't feel I was properly like educated. And every once in a while, I'd like go back and just try to read on myself, like what the latest guidelines were. But I felt like I was just, what I'd find was just like old guidelines. And I was like, well, are these even up to date? And so, you know, and I, you know, tried at one point I did try prometrium and estradiol, but I went from I think birth control pills, which I now know are, you know, very, very super therapeutic levels of hormone levels to, you know, estradiol and prometrium, which are very low levels of hormones. And so at that point, that was my intern year. That's when I experienced like hot flashes, mood,
Mm.
like,
Oh
and
gosh,
like
that sounds
it
like a
was
perfect storm.
it
Yeah.
was, yeah. And so then I came off of hormones. I was like, okay, that is it. Like I'm done forever. And so I was off for quite some time. And so, yeah, it's just kind of been a journey of self-learning. And then just recently, maybe 2023, I came across a course that talked about like POI specifically. And that was one thing I felt like I didn't find a lot of information on it, especially when it came to secondary to chemotherapy treatment. And so you know, I just was never sure if what I was reading was right or not or up to date. And so I came across this course and she spoke a lot about POI and that kind of led me to my journey through loving like women's health and wanting to educate women on hormones and all of that. So that was an unexpected consequence of it, but I'm glad it worked out. So
That is so cool. I mean, I didn't know all those details and just to think about it. And that's why I love helping women physicians is because like we try to be patient, we try to get the information that we need and like sometimes our doctors don't know, right? Because maybe they
yeah,
weren't trained in it. Like
yeah.
I didn't know really much about POI
Hmm.
at all until I was a reproductive endocrinology fellow. And I'm grateful that I was at a place where we saw a fair amount of patients, with
Yeah.
POI, but I really recognized I was like there's a whole gap like but then when I would go to look for things studies and everything I'm like my questions as a very very curious REI fellow are there like we don't have answers and I think you're right
Yeah.
like everybody extrapolated the data from the WHI study to like people with POI
Hmm.
and it's like how can you
Yes.
extrapolate an unhealthy 65-year-old woman smoker data to like a
Yes.
27-year-old who's like
Mhm.
otherwise healthy and so I think you're right. There's
Yes.
you're really bridging the gaps and there's this notion in medicine of like the wounded healer. Like obviously I'm sure,
Hmm.
POI was not your cancer was not your strong point A for your life, right? But it happened in college and you
Hmm.
dealt with it. And in a time, that's why I asked your age is because that
Hmm.
was even before the ASRM had removed the experimental label on egg freezing. So like,
Oh.
you was sort of in that zone of like we still, didn't really even know how to freeze eggs then,
Yeah.
right? So it was
Hmm.
like so okay. So we are where we are, right? And you've obviously educated yourself and you helped many other people.
Hmm.
How has this diagnosis shaped your experience? I would ask both as a woman and also as a physician.
Yeah. So I think, you know, as I kind of discussed or mentioned, like, you know, when I was first diagnosed, honestly, the focus was just like, I just need to, like, honestly, my focus was just on school, getting through treatment so I could get back to school full time. I was taking part-time classes at the time up until I found out I had to go through the stem cell transplant, and that requires prolonged hospitalization. And so I had to drop out that semester.
Mhm.
But even then, it was just like, okay, when you get through this, we need to get back to school. We need to get to med school. Like, I was on a mission. And so,
Yeah, 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 yeah.
I don't think, that I took the time to even process it, to be honest. And then you go through med school and training, and it's just like suppression of emotions even more, just get through, get through. And I think you've mentioned that too, like going through like 6 years of like not experiencing any emotion. And so I think it's
Yeah.
something that, I still kind of like, or especially in the past few years, just kind of have reflected on a little bit more and been able to process things. But um, I think from my experience, it taught me that women have different values, different goals, and needs in life, and whether a woman wants children or does not want children, or whatever needs or wants she has, I think that needs to be respected. I think it needs to be supported. But I do think it's also very important to educate women, because I think if you educate them on their options, I think that can have play a big role in maybe what they want, whether it's at the moment or even later on in their, maybe 5, 10 years later, that they're, our values change. And so maybe that changes things. So I think that teaches me, number one, just respect where a woman is at that point in time with whatever she wants, but also make sure she's fully educated and fully understands everything, not only about fertility, but also just regarding her health in general, because, taking care of your body now is what's going to affect you down the line, and so making sure that we're just supported throughout. I think that's very important.
Yeah. Yeah.
So yeah.
So then before you got this diagnosis, was having a family something that you desired?
I think it
Okay.
it was, but
Yeah.
I wouldn't say that it was something that, I know there's some like girls who like from like when they're little, they dream of having kids and in a family, and I come from a big family and I love it, and it's loud and everything. And I don't think I didn't have that like desire, like, oh, I want this many kids, and I'm dreaming of my, my fairy tale life. I never really had that. But it's something that I think just expected and just thought about, but not to, extreme degree. And so I think maybe it was a little bit more. And then, when you're in school, you're just kind of like driven. And it was I don't know, I was 21, like it was still like young, and it wasn't something that I thought of honestly too much. At that point in my life, I was just so focused on school, and kind of
Mhm.
getting through. And so I think my age kind of played a role in it too.
Yeah, absolutely. I mean, I think, female physicians, even without, a cancer and POI, like most people don't think about it because it's like, oh, this is
Mhm.
just going to happen for me. And then
Yeah.
it's like,
Yes.
then that's why when, at least 1 in 4 female physicians has infertility. And it's like, okay, well, maybe this is something that for everybody, we should have some sort of curriculum or,
Hmm.
like you said, like people educate people about their bodies
Yes.
from an early age to say, like, this is sort of how our bodies work and
Hmm.
all the details. um so then, as you navigated this diagnosis, was there grief to process? Was there, if you were like, okay, well, this might be in the cards for me, what was that like for you as you were like, okay, med school, residency, like now trying to build like an adult life for yourself? What has that been like?
Hmm. Yes, I think it's, to be honest, I feel like a lot of it, I feel like I'm still very driven and just kind of trying to figure out the next step. And I think my diagnosis kind of plays a role in it, because once I kind of found out, I was just like, okay, well, like motherhood's not in the picture. And I know there's different options, but in my head it's just okay, motherhood's not in the picture. Okay, like moving on. And I think it was just kind of
Yeah.
like in that like driven, focused, mission focused, like, mindset that, that's out of the picture. So we're just going to focus on career, life, family, otherwise. But and I think that played a role in it. I think kind of made me, to be honest, a little bit like just regarding myself, not allow me to like, I think, fully process like emotions, and just kind of like, okay, we got goals, we're moving ahead, and that's it. And
Right.
so I think I think it did play a role in that, and that's just something I'm still kind of like reflecting on, and so
Yeah. And I thank you for sharing that, because I think, sometimes it's like, oh, then and now, right? But like there is this messy middle, and like
yeah.
so much of life is being in the messy middle. And navigating, and like
Hmm.
there's no there. It's like this,
Yeah.
we peel off the layers of the onion, and I understand it because you're busy, and then you start a new
Hmm.
practice, and then you put your focus on that,
Yeah.
and at the same time, like we, as we feel called to do, like even just creating space to be like, what's there. I'll never forget.
Hmm.
As I was starting to get into coaching myself, I had a coach who was just like, just get your journal out and write. And I just stared at the page, and all I wrote was like, the silence is so loud.
Wow.
Because I was like, you know what? Like, just like you, go, go, go.
Hmm.
My running joke at Love and Science is I'd rather clean a toilet than feel my feelings. And there is a lot there. And it can be a
Hmm.
lot more comfortable to be like, I'm going to stay in the achieving mode. And that's like
Yes.
a dopamine hit. It gets rewarded. But
Hmm.
then when there's this other side that's like more uncomfortable, and especially if you don't really know the right supports, like,
Yeah.
my doctor brain, of course, is like, okay, like I want to know all the things. I want to know, okay, what was the setting of that consult when you were 21 years old? Did you say
Yeah.
21?
Hmm.
Was it in the hospital? Was it outpatient? Was there time to freeze eggs? Like, when you reflect on that time, is there
Uh-huh.
anything that you wish had been like, like, if you could rewrite the script, how do you
Yes.
wish that had gone?
I think I wish there was a little more education, a little more conversation. I did feel like it was very rushed. And at the time, I
Mm-hmm.
was like, yes, because I need to get, I've got a mission, I've got goals, I need to get this thing going. Like, and so, my parents are immigrants. And so English is a second language. And then I throw onto it medical English.
Right,
And
right,
so
right.
it's totally different. And I think it's just the time in medicine, like I don't even know, like translation, like services, how much we had them back then. Like, I don't know.
Mm,
I can't remember. But there wasn't any when we had this discussion. And I think also just like how you mentioned, like medicine was at a different place at the time. Like I don't feel like anybody was talking about freezing eggs or anything at that time. And so I don't think it was a very big, I think it was like, maybe mentioned briefly, but it wasn't actually like really done. And I was, and the cost and everything like that. Like to me, I remember thinking like that's like extreme cases, like and it didn't really cross my
yeah.
mind. So I think education, a little more time spent on it, or just more dedicated time, because it was just kind of discussed like at the beginning of like my oncology appointments, when we were still kind of like doing testing and bone marrow bone marrow testing and all of that. And so it was just kind of at the beginning of the conversation. And looking back, I don't blame my team, or my oncology team. Like I love my
No,
oncology
no, but
team. They were,
still.
I had like the best oncologist, the best support system. I just think that's where we were in medicine at the time.
Yeah, but I think you bring up that there's so many layers, right? There's,
Hmm.
being the age that you were, not being a fully formed adult yet,
Yeah.
having parents who, obviously very well meaning. And I mean,
Hmm.
as a native English speaker, I struggle with medical
Yeah.
jargon,
Yeah.
and so it's like, then you add in all those other layers and finances, and it just like, you can see how
Hmm.
it's so overwhelming. So I'm just thinking about it. Okay, so, as an REI today, what could I do in 2025, 2026? Could
Hmm.
I, have a follow up, loop back with the family after a couple of days? I think now we have patient care navigators who,
Yes.
who help with these things.
Hmm.
But I think you're right, like slowing down the process as much as
Yes.
possible in the storm,
Hmm.
that there could be value in that. And
Yes.
then, my author, Dr. Brain, is like, okay, well, we think in black and white terms, like, I will say personally, I have had many patients with a history of chemotherapy
Hmm.
who did end up conceiving, and
Hmm.
it's not all or none either,
Yeah.
and with their own eggs. And I think it's to say, okay, well, it's a 5 to 10% lifetime chance, for
Yeah.
people who are having regular experiments, or like there's like all these things, but it's more common than we realize. And so to say, okay, well, you know you can support yourself with your hormones. Again, I'm saying you, but like, if I'm talking to
Hmm.
my listener, like
Yes.
anybody who's listening to this, like, we know so much more, that there ovarian activity is not all or none.
Hmm.
Sometimes
Yeah.
people fire off a follicle, and then
Yeah.
that's an egg that is
Mhm.
useful. And there are people who even do egg retrievals for like one egg at a time, especially if people are on the younger side. So the science continues to evolve, and the
Yeah.
question then
That's
becomes,
true.
as this educated woman, how do I keep up with it? How do I get
Hmm.
my A team? How do I get my REI who can bring
Yeah.
these things to me as I am, getting you're older and all these things,
Hmm.
like, oh, did you know about XYZ? Like all these things are so important to think about, right? Because I think
That's
for
true.
people, POI, yes, whenever I see someone with POI, I always know it's going to be multiple appointments, because it's like, okay, we need to address the endocrine side of things, which is,
Hmm.
like your bones and your heart and your brain and your
Yes.
sleep and all those things. So we got to get the hormone stuff teed up, which,
Yes.
by the way, is not a birth control pill. For those of you who are listening, that's not the right answer most of the time. Estradiol is like is great
Uh-huh.
in appropriate doses, as you know. So there's the hormone side of things, but then there's also the family building side. What are your desires? What are
Mhm.
even in the context of this diagnosis in this situation, like best case scenario, what could happen? What does motherhood mean to you? All those different
Mhm.
things. And it's a complex question, but I think that
Yeah.
we as doctors need to be held. We need to be supported. We need to be held. And so
Mhm.
finding your team who can do that for you as you start to unravel these things, I think there's no there. We're always becoming, right?
Yeah, that's true. That is very true. Yes.
Yeah. Yeah. So I will say POI, it is a very, very difficult diagnosis to assimilate, really. And
Mhm.
like you said, there's many reasons that people can come to it, whether it's a Turner's mosaic or
Mhm.
FMR1 fragile X mutation, or now we're finding more and more people have autoimmune primary ovarian
Mhm. Yeah.
insufficiency, where there's antibodies that destroy the ovaries, and then iatrogenic, like chemotherapy. Like obviously you needed to stay alive, and
Yes.
unfortunately it had this effect on your ovaries. And so how can you live the best life possible in all the
Hmm.
ways? It's an ever becoming process.
It is, yes. And
Yeah, yeah.
you bring up good points in that medicine is always changing. And, I think that's, even in my situation, you just never know, like when you might have, like you had mentioned, like you might have like an egg that just pops up out of nowhere. And that's good to know and to remember that, like, it's never a completely closed door, unless your ovaries are completely removed. It's never, with medicine just
Right.
ever evolving, there's always, an opportunity or a potential, I guess. So that's
Yeah.
good to know and good to remember.
Yeah. Like I said, I've had many, many people, and I think it's complicated though. So it's like, okay, do
Mhm.
I do I do I enter a relationship?
Yes.
How do I disclose this
Hmm.
information?
Hmm.
Like, I think sometimes we have this idea of like the traditional approach of like a husband and the family and all
Yes.
these things. Like, there are some people who have beautiful relationships who don't have children,
Hmm.
and there's so many different ways that people do it. But it is, it's kind of like if somebody has testicular cancer, and like at the beginning of the process, like, hey, just so you know, this is the
Yes.
situation. It's like, okay, but I think we are who we are, and none of us would be who we are without the journeys that we've gone through. And
100%.
I mean, people say like, who are the people you choose for your friends? Well, there's certainly people, they're not people who haven't faced adversity. Let me tell you, like my dearest friends are my
Yes.
friends because they're super strong,
Yes.
super interesting and resourceful, and know how to support other people during hard times.
Hmm.
And so I would imagine that you've created that kind of community for yourself, right? Like with the people who
Yes.
are dear to you, that they're also
Mhm.
people who have known struggle, who have known pain, and all of
Yes.
these things.
Absolutely. Yes, for
Yeah.
sure. Hmm.
So as of today, like, where you live, have you found a medical team that you feel is like your A team right now?
Hmm. So I'll be honest, I am not the best patient. Like,
Well, you're in good company, because most female physicians are not, the best
yes.
patients. So thank you for sharing that. You
Um,
know,
yeah, so I need to be better about my health.
that's it. Well, you know what? That's why we're here, right? It's like you asked to be on the podcast for a reason. So let's get into it. No. What is the closest city to you?
The closest big city I
Like,
have, I'm between Columbus and Cincinnati. So I've
okay.
got two good
All
cities next.
right. All
Yeah.
right. Let's talk about offline about getting you your A team. How does it? But the point is, okay, I'm using this as an example, but every
Mhm.
single person deserves their A team. I think as
Yes.
female physicians, when I look at like metrics of success, I'm like, have I seen my dentist? Have I seen
Mhm.
my eye doctor? And I'm like,
Yes.
oh shoot, my benefits are running out. I got to get to my eye doctor,
Yes.
like, but like, I truly think that like we need to have a checklist as female physicians. Even this morning,
Hmm.
one of my coaching clients dearly messaged me. I coached her yesterday, and she's somebody whose fertility journey is changing. And I said to her, she's like, I really want to focus on my health at this point. I said, okay, have you had your pap smear? Yes. Have you had your mammogram? No. Okay. So here are the guidelines. And, this morning she texted me. She's like, guess what, Erica? I booked my mammogram. Do you know how happy that makes me? But but I think all of us female physicians are floating out in the world, mostly without our A team.
Yes. Yeah. I
And
think
like,
we feel a responsibility to care for everybody else and,
right,
you know, don't do
right.
it for ourselves.
Right. And so, maybe, just like a gentle nudge to say, okay, so, for each person, like what is, my dad had precancerous polyps. So like I've had a colonoscopy even earlier than recommended.
Yeah.
Like those things, like we would obviously tell a patient to do those things.
Yes,
But when it comes to
100%.
ourself, there's like almost like a block where like, oh, I don't have time. I
Hmm.
need to keep taking care of all the other people. I gotta grow my
Yes.
practice. Like, but I will say, like, we have to practice what we preach. We have to do it. We have to do it because we just that's how people know that they can trust us when we walk the walk.
Hmm.
And I think it really first starts with permission to be like, okay, I'm a human being. I deserve to be a patient too. Obviously, if you have
Hmm.
cancer, you don't really choose. You're like, okay, well, yeah, obviously I'm a patient. But I think as we think about coming out of this quality of life
Hmm.
issues, um we need to think about that. So this is a message to every listener. If you do not have your A team, which includes a primary care doctor, you know with or without OBGYN, some PCPs do, some OBGYN, some
Yes.
don't. Making sure that you're up to your healthcare screening. I think that every single person going through this deserves a coach, and plus minus a
Hmm.
therapist. Like, I think we have to be supported for this work to be sustainable. I recently went to
Yes.
a conference that was largely on burnout, and there's a reason we as female physicians get so burnt out. And part of it is medically caring for ourselves that we can continue caring for other people. So I would
Very
love to help you,
important.
Dr. Esra. And again, you can say absolutely not, but I'd love to help you get your A team together at this point in your life so you can
Thank
start
you.
to keep working through all the things, because it is a forever arriving journey for sure.
It
Yeah.
is indeed. Yes,
Yeah.
absolutely.
Like you deserve someone to say, okay, like let's look at the endocrine side, which it sounds like you've tinkered largely yourself, which is let's look at the new POI guidelines. Did you know that you might know this, there are new POI guidelines that were released, and my
Mhm.
good friend Dr. Callan, who works with me at UVM, she was one of the authors of those guidelines.
Oh,
And
nice.
yeah, and if you haven't seen them, I'll send them to you. But I like this there's a new wave. It's kind of like how like menopause is having a moment for
Hmm.
like
Yeah.
traditional age perimenopausal women. I think like POI is having a moment too, and I think
Hmm.
we need to honor that,
Yes,
you know?
absolutely.
Okay. So as we talk about this, in an ideal world, what kinds of support do you envision for people with POI? Both like medical support, emotional support, other kinds of financial support. Like in an
Yes.
ideal world, obviously people come to the diagnosis from different perspectives, but
Mhm.
what would be like your ideal, if you could have like a POI center, what would it look like?
Yeah, so I think it's important that it's very like multifaceted and includes like all components of that because it's a very, there's so many components and aspects to this diagnosis. So, medical support, of course, is important to make sure that our body is functioning like it's supposed to, so hormonally. And of course, the fertility aspect is a big part of it. And so exploring that and making sure we're, continuing to look into the most up-to-date guidelines on that. But then also just making sure our hormones are there, are present, that we're on, hormone therapy. Because we need that for our heart, for our bones, our brain, just for bodily and, health. We need that. We need those hormones. And so that's a big part of it. And then also just looking at other health aspects, like making sure our nutrition is on point, our, exercise, strength training, aerobic training, all of that is on point, sleep, stress, all of that is a big component of health as well. And then that also will lead into like emotional health as well. So making sure we've got good support systems, whether it's someone who's going through it as well with you, where you can just kind of share in your journeys together and, have someone who is also going through it that you can talk to, but also support from outside sources as well, whether it's one-on-one or group as well. I think that's important. And I think also like you mentioned, the financial aspect of it and having somebody look into the cost of different treatment options if you wanted to pursue those. I think that's all very important as well. So I think it's in the ideal world, you would have a center where you've got people helping you from all of those aspects, and having that available kind of as an ongoing support
Yeah.
system.
Yeah, and can we just talk about how, being on hormone replacement, which is not again to like flood the body with hormones, but it's to be the whole point is to be giving the body back what your body would be making right now at
Yes.
36 without POI. And so
Mhm.
I talk with like hematologists all the time who are like, you're going to give her a blood clot. And I'm like, I'm giving her physiological estrogen that is getting her to where her
Yes.
body would be, without this diagnosis that is going
Yes.
to left undisturbed, like lead to osteoporosis, lead to
Mhm.
early cognitive decline. I mean, let's talk about it.
Yes.
Like dementia, cognitive decline,
Heart
heart
disease.
attacks,
Yes.
heart disease. Like, let's talk about these things. Like, I mean, I really want to avoid dementia if that's at all possible.
Right?
I really, I got my lipid panel done, again, in the vein of me taking care of myself a couple weeks ago. I'm like, okay, here's my LDL. Can I do any better? Like, I think we're all very
Yes.
driven, but I
Mhm.
think we have to think about like there's data that female physicians like have really much earlier mortality rates, and like why is that? Part of
Mhm.
it I think is related to stress, but I think part of it is because we don't really take care of ourselves. And so
Yeah.
if you are living with POI and you're like, okay, well, I get a period every now and again, and whatever, like we
Mhm.
really need to be, and it's not just a birth control pill, because that's sometimes that estrogen doesn't get into our system as well as the natural
Mhm.
estrogen. We have to be looking at, okay, what am I doing both for quality of life now, both in terms of like hot flashes and cognition and sleep and
Yes.
vaginal health if that's relevant, like all those different
Mhm.
things, and mood, all of it. And then how can
Yes.
we also look at like longevity and long-term outcomes, which brings me to
Absolutely.
ask you about your practice. So you
Yes.
are an inspired person. I mean, I the first moment I met you, I just saw your drive and I was like, okay, watch out, world, because it was before your practice even open. And I was like, okay, watch out, like this is happening. And now like following you on social media and like truly physically observing the weights that you lift in your life. Tell me about this component of like the combination of like hormones and strength training, and like tell me about
Mhm.
your passion for what you do, because I think that so many busy female physicians are like, oh yeah, weightlifting, that sounds fantastic, but like how would I
Mhm.
ever do that?
Right.
Like help us understand why it's so important, but then also like how can we practically access it, especially if we are like holding up the world for everybody else.
Yes, yes, absolutely. So, yeah, so strength training and just health in general is very important to me. So, with my practice, I really focus my passion is on, educating females, and also males that, so hormones are important for males too, but, my passion is females, educating them on the importance of hormones, and their effects on our bodies and as on our aging, the importance that for osteoporosis, preventing fractures, which can lead to mortality, preventing heart disease, and dementia and everything. They're so important to our life. And so just really educating them so they can make their own informed decisions. I think that WHI really had a detrimental effect on this. And many females are still scared of hormones and don't understand their importance. So that's number one for me, is just really educating females on this, and helping them, because there are a lot of doctors and providers who are not comfortable with hormones. And so just being an extra resource for them to get treated appropriately, when they're ready for that. And then number two is lifestyle. So lifestyle plays a huge role in, our health. So strength training is very, very important to me. It was a big part of my recovery process during my cancer treatment. That's really when I got into exercising. Before that, I really wasn't active at all. And I started off doing just home workouts, honestly, for several years, pretty much almost the same like DVDs, like over and over again. And then I stepped foot into a gym one day, and, and the rest was history. It was a huge, number one, I knew was important for osteoporosis and just strengthening my bones. But from there, it's just such a huge mental just a mental relief for me, stress reliever for me. And I always joke like it's really just like a benefit to the world that I strength train, because otherwise I might be a very mean person. Um, but it's just, there's nothing better than having a really like tough, exhausting day at work, and then going and just getting, you're not really in the mood to exercise or lift weights or anything like that. And then I go in for a session and it's like I leave like so happy and just so positive. And so I think that is one, aside from the health benefits of it, I really want females and anybody in general really to experience that. The emotional and mental relief that they can get from exercise. But it's so important for our health and our longevity. It prevents so many metabolic diseases like insulin resistance, and helps reduce the risk of osteoporosis so that we can live healthy lives and we can move and live independently. And that's so important as we age. There's so many benefits of strength training. Oh, and so I'm so
Yeah.
passionate about it. And people are going to have different time restraints, with work and family. And so number one, I always tell my patients, if you are starting from zero and you have nothing, I am always demonstrating like assisted push-ups and squats in my exam rooms like every day with every patient. And so that's one way to start. And from there you can progress. In even just getting into, if you have access to dumbbells at home, getting into workouts, like 30-minute workouts like a week, that can have so much positive effect on your health. It really doesn't take that much. Certainly, we want to progress and progressively overload over time, but I think that's just 2 half-hour sessions if you can do that. And if you can't do that, honestly, just incorporating little exercise snacks like throughout the day, whether it's like, maybe a minute of push-ups, whether against a wall or against the counter, you're waiting for something to heat up on the stove or in the microwave, or you're waiting on, picking up your kids, doing something rather than sitting in your car, step outside the car and maybe do some like jumpy jacks or running in place. Other people might think look a little weird at first, but you know what? You're going to motivate them to do it too, because they're just sitting there. And so it's getting in and honestly where you can. But I think that we just have to be motivated and just kind of, I guess, just make sure that it's a priority for us. Because without that, you're not really going to get started. And so that's, it's so important. It's so important. And I really want people to experience the positive effects on it has on their health and
Yeah.
their mind.
And I feel like it's a secret that people don't know. So I mean, I'll tell you, like I was a runner, a long distance runner, ran
Mhm.
marathons, and used to be competitive and all those things. And so I feel like I didn't discover strength training really until my 40s. And it was
Yeah.
when it was like, okay, well, we lose muscle as we age, and like muscle is kind of the key to longevity. And like if you want to
Mhm.
think about your 80-year-old self, your 90-year-old self,
Yes.
and like what are you doing now so that you don't wake up
Mhm.
at like 70, 80, like as a
Yes.
very weak person, and then it's like you can't really, I mean there's some things
Hmm.
you can do at that point, but you really need to
Right.
start sooner to like
Hmm.
get a
With the
foundation. And so
most.
but like what would you say to the person who's like, yeah, I have like such little time, I get in like 2 to 3 runs a week, that's like my thing, but like I can't
Hmm.
even like what additionally like for me, I'll tell you, like I have discovered Orange Theory Fitness, and again,
Uh-huh.
it's not to say one way is better than another, but
Yeah.
I tried for like an entire year of like going to the gym and weightlifting, and it just always felt like a chore. I was like,
Hmm.
okay, I have to do this because I want to be live a
Yes.
long, strong life, and it like was never anything I enjoyed. And I always tell people like
Hmm.
find the exercise that you enjoy, because it's like a lot
Yes.
easier to do it. When
Hmm.
I'm in a group class, like I don't even think, even this morning I went to Orange Theory and like got fist bumps from my people, like that's just,
Yes.
but like
Absolutely.
the music for me, like I
Hmm.
actually forget that I'm like lifting weights because of the environment. And so for
Yes.
me as a person who like, for me it's easy. Some people say, oh, I don't know how you run, I just hate running. And I'm
Hmm.
like, okay, well, trick your brain and like find a way to do it. Like what would you say to the person like me who like naturally does not love to lift weights but knows
Hmm.
it's important? I've got the drive, I've got the motivation,
Yes.
but like how do people find a way that works for them when
Hmm.
it feels more like a chore at first?
Yes, absolutely. So I think there's two parts of that you kind of touched on that are both important. So number one, I would say, you know, think about where you want to be in the future. We all do things that we do every day that we don't like. So many of us would not want to work like, so many hours every day, but we know that we have to because we need to be able to pay rent and feed ourselves and, hopefully save for the future too. So, we're not always going to have that motivation, and I don't even always have that motivation. So number one, just creating that habit. And I always say just start somewhere, and maybe you don't have the motivation, but let's give yourself at least 10 minutes. And if you're absolutely like, dying and you can't do it that day, fine. But, you can't use that excuse every day or break it up into something that you can do. So that's number one. We're not going to always have the motivation to do what we want, but we have to look to see what's important for us in the future and where we want to live our, how we want to live our life. We got to do that. Number two is finding something that you enjoy. So try different things, whether it's group classes or, getting a trainer to motivate you or finding a friend, or an accountability buddy. There's so many positive things that can come from groups. And so I think that's a big part of it as well, is just the accountability, but also the social aspect of it. And, health is a big part of lifestyle medicine too. Like that's a big pillar, and that helps promote longevity as well. So that would be another thing. And then, just breaking it up into chunks in the day. If something is too, if you can't do a long session because first, that's mentally just a little too much, start with where you are at, whether it's a minute here, a minute there, 5 minutes, do what you can and progress from there. But, I think it's important that we really look to see what we want our future life to be like. Do we want to be bedbound, relying on others, Because if you don't, then you kind of have to start. You start now, sometimes it's hard to look into the future and imagine things. But I think if we look around society today, we can see a lot of that where people were, look back and like, oh, I wish I would have done this when I was younger. And I think that's really important to consider.
Yeah, that makes a lot of sense. So the first thing I heard you say was to, just code it as something we all do things every day that we don't,
Hmm.
necessarily enjoy. Maybe we might enjoy it by the end, but like
Yes.
part of life is showing up and doing things that you
Hmm.
don't want to do. And part of it also, the second thing is having a structure. And so like,
Hmm.
if I have something in my calendar, I'm going to do it. If it's a grand rounds,
Right.
I'm going to go to grand rounds. And so like we all do those. Do I love grand rounds? No, but like I go, right? So
Hmm.
like if I have an appointment with a trainer at 7 o'clock on a certain
Yes.
day, then like I'm gonna go to that appointment too. And so
Hmm.
creating structures in our lives that make it easier for us
Hmm.
to say yes. Like I will tell you, like I have my schedule of when I go to Orange Theory because my brain can't handle one more
Hmm.
decision. It's like kind of
Yes.
like, Dr. Una talks about our CEO calendar, like,
Uh-huh.
this is when I go to Orange Theory. I go at
Yes.
least twice a
Hmm.
week and these are the people I go with. And, my brother
Yes.
and I have gotten into it recently. So we go to
That's
class
awesome.
together. And
That's
like
awesome.
those are the ways that like make me like forget that I don't like it
Hmm.
and it like becomes fun. So I'm all about like
Yes.
how can we trick our brains, especially initially, to like what is good for us, whether
Hmm.
it's like dietary, whether it's sleep, whether it's
Yes.
reducing social media, whether whatever it
Hmm.
is, like I think we
Yes.
have to find those little like ins, and
Yes.
then over time we'll be like, oh my gosh, I like the thing that's good for us,
Yes, and that's a big part of it. It's going to take time. Like it probably took me at least a year of consistent, exercising where I finally became to enjoy it and started to realize like the mental benefits that it brought me to. And so
Yeah.
it's something that's going to take time. It's going to take trial to find what you like, what works for you, what doesn't work for you. And that might even change over your lifetime, but it's going to take time. And so we just got to think about the end goal and then just find ways to be creative.
So true. And like the close people in my life are like, hey, do you need to exercise? Do you need to go sweat it out? And I'm like, okay, we could even think of it as an altruistic act for humanity.
Absolutely, yes, for sure.
That's amazing. Okay, my friend, is there anything else that you want to share either about your own journey or, your approach to helping women live their healthiest lives
Mhm.
that we haven't yet covered?
Yeah, I mean, I just want to say, we all experience different journeys and different, um, troubles in our life, and we go through things. And I think when we come out on the other side, we come out stronger. And I think that's a way to help inspire others. Taking that and being able to inspire others is, is something that we can, push out to the world and bring benefit to others. And so I think with me, my personal journey, there's so, yes, it was a tough journey, but there's so many good things that have come out of that and that I've learned about myself and continue to learn about myself, whether it's from my health journey, which has led to, my medical journey and my career and things that I've learned along the way. And, I think it's just important to reflect back and just kind of take a little bit of everything from your experiences, even the worst experiences. There's good that comes out of it. And I think it's just the way that we think about them and how we take our reflection from that. And so I think that's really important. So I hope that through my journey and through my story and the growth that I've had from it, that I can inspire many people and push them to be their best selves.
Absolutely. And thank you so much for sharing your story. And thank you for everything you do in the world. You're truly an inspiration. Can you tell our listeners where to find you?
Yeah, so I am on Instagram, TikTok, YouTube, and Facebook under Dr. Esra Shermadou. And then I did also have recently created a new Instagram page called Dr. Esra's Got the Iron, where I put a lot of my weight training things there. And my goal is to be able to post more home workouts and dumbbell workouts and different types of workouts where anybody from any journey into strength training can get started. So that's kind of the focus of that page, and I'm hoping to start doing that very soon. So
Yeah, amazing. And I love your social media. I always am inspired when I see you, like
thank
not just
you.
lifting the heavy weights, but connecting it to like important life messages and things that
Yes.
just remind us to be the best version of ourselves.
Thank
So go
you.
follow her now, listeners. And I'm sure, especially our listeners with POI are really going to resonate with your message. So thank you again for sharing.
Thank you for having me.
Okay. All right. And to my loves, I love you. Until the next time. Bye.